Nigeria, for the first time in the history, we reached an important milestone, which is 7 months without any polio virus case detected. So the last case was reported in 24th of July, 2014. This has been an important decrease when we compared in 2013, we had 53 cases, and in 2012 we have around 120 cases. So this, it's a remarkable achievement for the country. I think the first one that's important to highlight is the government of Nigeria commitment to interrupt polio in this country. And this is led by the President himself through the Presidential Task Force for Immunization. And the coordination by Mr. President with all the governors, the 37 states, it has been critical, but not only in terms of coordination, but also in terms of allocation of resources. In 2014, the government of Nigeria allocated $50 million for the polio activities. 80% has been allocated for WHO and 20% for vaccines through UNICEF. But the second important activity is WHO presence in the field and also other partners, but most particularly WHO, who have a big surge capacity that has been located particularly in the northern state areas. Even those states with the security compromised situation, we have staff in the field. And this has been critical for us to reach the stage that we have reached so far. This has been fundamental for us to mobilize the population. They have been key in terms of communicating with the parents to understand why it's important to continue to vaccinate the children. And the traditional religious leaders has been very supportive in all of those interventions. Very recently, we also, end of last year, we also introduced the inactivated polio vaccine we call IPV. This was made particularly in the northern states, in Borno, Yobe, some parts in Kano state, which is the central part, northern central in Nigeria. The IPV is extremely important because it boosts much more faster the immunity of the children. And from 2 weeks ago, we also launched the IPV in routine immunization in 11 states in the northern. In March, we are going to introduce the IPV also in all the other remaining states. This is an important intervention and is going to be critical to interrupt the transmission in Nigeria. We expect that by July 2014 to not have any case, but we are going to start a very high transmission period. We know that we still have a lot of challenges ahead of us. Accessibility is one of the issues because of destruction of most of the health infrastructures. So access of health care has been a big concern. Therefore, all of these interventions to reach every child has been critical, and we are going to continue to do that. But we need to continue to advocate that to put polio and all the investments that has been made by the government, by the international partners, by the private sector, we are not going to lose the gains that we gained so far. So therefore, our advocacy for the new management is going to be important for us to ensure that the bottom-up approach in order to interrupt the polio is going to be put as a priority. The involvement of the governments, the involvement of the civil society to understand that the phase that we reached so far is going to be critical for us to interrupt polio, which is a global priority for all of us.